Hello medical coders. In this video we're going to see about modifier 25. Let's get started. This is Surya Johnson, your medical coding guide. Hello my dear medical coders. So in today's video we're going to see about modifier 25. As I already told, new to this channel, I welcome you. Please subscribe and hit the notification bell icon so you'll not miss any of my coding related videos. I already told today's video is going to be about modifier 25. This one is applicable for all who is working for US based clients or fresher medical coders who are going for the examination. And also this 25 modifier is going to be a special modifier for coders who are working in Abu Dhabi and ALAIN region. If you are new to this Abu Dhabi and ALAIN region coding, you'll be wondering why it's so special for Abu Dhabi and ALAIN region, because there is no modifier usage in Abu Dhabi and ALAIN so far. Yes, there is no modifier usage. In September 2023, DOH, that is Department of Health Abu Dhabi, introduced the usage of modifier 25 from September 2023. So this is actually a late update. I've been busy with life. So first of all, what is modifier 25? We'll just have a look into that. Modifier 25 means, in the description, significant separately identifiable evaluation and management service by the same physician or other qualified healthcare professional on the same day of the procedure or other service. So this is the description of modifier 25. The DOH appendix regarding that modifier 25 states E&M services rendered on the same date of service by the same facility, same clinician, as that of a minor procedure for the same principal diagnosis or chief complaint shall not be reimbursed separately. And there's an however, and after that there are 4 points. We will discuss about these 4 points at the end of this video. Before that, we'll be looking at what is modifier 25 and in what scenario you'll be coding modifier 25 and what and all should be taken care while choosing modifier 25. We'll first understand that, then we'll get back to the appendix that is released by the DOH regarding modifier 25. Coding modifier, first thing you should understand, modifier 25 appended to the evaluation management, the E&M service only, not to the procedure service. You should be appending the modifier 25 to evaluation and management service, that is the E&M service only. So when you will append modifier 25, when there is an evaluation done to the patient and there is another procedure has been performed. So there is a procedure that has been performed. For example, an incision and drainage has been performed on the patient right hand. Apart from that, the doctor is also evaluating and managing the right foot pain and swelling that has been reported by the patient. So there is two different things are happening here. One is incision and drainage done on the right hand, which you will be coding the IND code 10060 or 61. You'll be coding the IND code. Apart from that, there is some other extra service evaluation and management done by the provider to the same patient on the same day to a different condition symptom. So the provider is not only focusing on one thing, he is also spending an extra time on a different thing. So in this scenario, if you bill only the procedure code, that is the incision and drainage CPT code, provider will be paid only for that service. In this scenario, doctor has also rendered another evaluation and management to the patient for a different complaint. In that case, you should be coding the E&M also. If you code this E&M and this procedure code, there are high chances of rejection of this E&M, meaning that this E&M is included in that procedure. So to avoid this rejection of the E&M, you should be adding modifier 25 to evaluation and management CPT to E&M code. Denote that there is a significant separately identifiable evaluation and management done by the same provider to the same patient on the same day. This short explanation for the modifier 25. You are informing the payers that this E&M evaluation management is separately identifiable and is not included into that procedure. For some minor surgeries, there might be a pre-service work, intra-service time and post-procedural time, right? These things should not be considered as a separately identifiable evaluation management. So this is included in that procedure. So the pre-service work, intra-service time and the post-procedural time should not be reported separately, and you should not append 25 modifier to that. For example, say the same IND of the right hand the doctor did examine the right hand, talk to the patient, explain the procedure in detail. Before doing explain the procedure, what are the pros and cons of the procedure, and gave anesthesia, did the IND, and after finishing the IND, the doctor advised patient. These things are not separately identifiable service. Only the procedure should be coded. No E&M should be coded with 25 modifier. And when there is a separate and significant E&M service performed only, there should be billed. E&M should be billed with the 25 modifier along with that minor procedure or the other service codes. The E&M should be on the same patient, by the same physician, and on the same date only. You should remember these points when updating modifier 25. This is about the modifier 25. When, where, and how, and when not to use the modifier 25. We have seen about these things, right? We'll see a few examples so you'll have an idea. So example 1, a dermatologist examines an established patient during a regularly scheduled skin check and performs a head-to-toe skin exam. During the patient's exam, a new suspicious skin lesion is discovered. The physician determines this should be biopsied and perform a punch biopsy. So in this scenario, the E&M would qualify as separately identifier services because the doctor has been examining everything like from head to toe skin examination, and this is a regular skin examination. Doctor has not planned this visit for that particular skin biopsy. The doctor has planned this visit for a regular checkup from head to toe skin checkup. During the checkup, he has found some suspicious lesion and he wants to perform biopsy. These two are separate. So in this scenario, you will be coding E&M modifier 25 with this punch biopsy. We will see the example 2. A woman arrives at the office with a suspicious lesion on her arm. She also complains that her left leg has been swelling and she has pain deep in her thigh. So before performing the biopsy on her arm, the doctor takes history related to her complaint of leg swelling with pain and examines the patient, including palpating the lower abdomen and accessing the lower extremities for varicosities and phlebitis. Later, the doctor counsels her to wear compression stocking and elevate her legs and schedule a follow-up to determine if conservative therapy is helpful. Then the doctor does the biopsy of the lesion. In this scenario also, you will be coding E&M code with modifier 25 and then you will be coding the biopsy. So this is how it works. If the doctor has done some extra work, additional work, not linked with that procedure, then you will be coding E&M with 25 modifier along with that procedure code. You see another example. A patient arrives at the office complaining of bright red blood from the rectum. So the doctor conducts a detailed history and physical examination, including abdominal, rectal, and genitourinary examination. Then the doctor performs a diagnostic anoscopy. In this case, you will be coding an anoscopy with the evaluation management. Some might say there is no two different diagnoses, Surya. If there is no two diagnoses, how can we code modifier 25 with an E&M along with the procedure that is performed for the same complaint? As per the guideline, giving one diagnosis or two diagnoses or the evaluation management done for the other diagnosis or the procedure done for other diagnosis is not the key area. The thing is, the doctor has done an extra evaluation and management examination along with an anoscopy. In this scenario, you can code an E&M with modifier 25 along with anoscopy even with the same diagnosis. We'll see another example. A patient arrives at the doctor's office complaining of left ear pain. After the physician has completed the E&M, he determines that the patient has impacted cerumen and performs impacted cerumen removal. So in this scenario, you will be coding only the removal of impacted cerumen because the patient came with the ear pain. The doctor examined the ear only and found the root cause. After finding the root cause, the doctor did the procedure. He didn't do extra evaluation and management and there is no extra service provider. In this scenario, you will be reporting only the removal of cerumen. So this sums up the modifier 25. Hope you have a clear picture of modifier 25. If you are a fresher medical coder, till now it is enough for you for the modifier 25 and we also saw few examples. So this is enough for you. So from now I'm going to talk about the DOH rule that has been released for coders who are working in Abu Dhabi and ALAIN region. So hope you all understood modifier 25, when to use and what are the scenarios. We saw few examples. I hope this will be beneficial to you. Let's talk about the DOH appendix. the adjudication rules. So the appendix states if the same doctor, same principal diagnosis, chief complaint for the same patient should not be reimbursed separately. That was the first thing they have mentioned. But however, now we have already seen the guidelines. So based on that, you will understand this. However, if there is a significant and separately identifiable E&M services unrelated to the decision to perform the minor procedure shall be separately reimbursed by the reporting the E&M service with modifier 25 if provided by the same physician on the same day as the minor procedure or service. So we already saw about the guidelines. So if it is unrelated, if it is separately identifiable evaluation management service has been provided, then you can quote the E&M with 25 modifier along with the minor procedure. Second point I mentioned here is the physician must appropriately and sufficiently document both the E&M service and the minor procedure in the patient's medical record to support the claim for these services. So for coders who are working in Abudhabi and ALAIN hospital and clinics, you should educate the doctors very well that the doctor should document same file so that we will have a justification to show when there is any audit. You should have the sufficient documentation to support the E&M with 25 modifier along with the minor procedure. There is no sufficient evaluation management documentation done, not report separately with 25 modifier if there is no extra workup done by the doctor. Third point here, modifier 25 shall only be appended to E&M services and may be applicable with multiple E&M services. So E&M, as I've already told, modifier 25 should be appended to E&M services only. By accidentally, if you're appending to procedure codes, it will not go. It will show error submission. Modifier 25 shall be reported as an observation field as defined in the routine reporting requirements published at the SAFFIA reporting portal. Your software IT will know about this. There will be an observation option in each CPT in all the softwares in Abu Dhabi and ALAIN region. So you should append this 25 modifier next to the evaluation management code in the observation area as per the SAFFIA reporting guidelines. So this is how you'll be appending modifier. So if you have any doubts in this modifier 25, please feel free to put it in the comment section below and send an email to this email ID. I'll definitely answer your questions. If you found this video to be useful, don't forget to like, share with your friends and subscribe and hit the notification bell icon, and also follow me on my Instagram page. Thank you so much for watching. This is Riya Johnson, your medical coding guide.